Hi, my name's Alexi, and I will be demonstrating how to do a saline lock, as well as an IV push, followed up by discontinuing an IV access. First, we'll start by our 6 rights of medication as the right patient, the right time, the right dose, the right route, the right medication, and the right documentation. So first, we're going to check our orders. It says that we have a saline lock IV after 2nd liter of normal saline has been infused. So at the end of the other video, should have showed that once our secondary or our piggyback tubing is complete, that we would put this as the high IV line. So what we're going to do is we're going to get our supplies ready. So we're going to flush it once we discontinue it. So I also have a hub cleaner. Okay, we'll do hand hygiene and we'll glove up. Hello, Ivy. I'm Lexi, I'm your student nurse. Would you mind verifying your name and date of birth, please?
Ivy needed 12/25 of 1984.
All right, and then do you have any allergies?
I'm allergic to penicillin and latex.
Okay, very good. So what we're gonna do is we're gonna be discontinuing your line. We're gonna leave in your IV access just in case we need to restart your line or give you any more medications. So to do that, we're just going to take off some of the tape. So now we're going to assess for any swelling, redness, irritation. Okay, so now we're going to remove our tubing. Of course, our IV will have stopped as well. We'll have clamped it. You're going to clean the port. And then we're going to flush it with 5 milliliters of water, or of normal saline. Okay, again, we're going to just check, make sure we didn't poke through or the integrity has gone. And then we'll also be documenting this in our nursing notes. We're also going to teach the patient to let us know if there's any swelling for infiltration or if there's any pain or discomfort. And then next, we're going to be giving Dilaudid per our orders. We have Dilaudid 2 milligrams every 2 hours as needed for complaint of pain during coughing. The label says we have 2 milligrams per milliliter, and then we're also going to dilute it into 2 milliliters of normal saline. And then it's also going to be a slow push. We're going to be giving 4 milliliters over 2 minutes. So the first thing we're doing, we're going to check our MARD, make sure that we have the right patient, and we're going to gather our supplies. So we're going to need some flushes. We need our Dilaudid and our normal saline, as well as a 3 ml syringe to draw up our medication and diluent. So we'll first draw up 2 milliliters of air. And put that into our saline. And then we will draw up 1 ml and put it into our Dilaudid. And then we will draw up our Dilaudid. Recap temporarily. And now we're going to carefully draw up 2 milliliters. Now we're going to disconnect our needle, and then we're just going to verify again, just to make sure that we have all of our supplies. So I've got my medication, and I've got my flushes with me. And now we'll go see the patient. Hello, Ivy. It's your student nurse, Alexi. Would you please verify your name and date of birth?
IV needed 12/25/1984.
And do you have any allergies?
Penicillin and latex.
Okay. So it looks like you're having some pain. Would you mind putting that on a scale, 0 to 10?
It's about a 6.
About a 6, okay. Well, we're gonna give you some Dilaudid to try and help with that, with your lungs. So first I'm just gonna check out your IV here, just to make sure that that nothing's going on with it. Everything looks good. So we're gonna go ahead and sterilize the port, because we're gonna do a flush to start. We'll be doing 5 milliliters of this. You're going to assess just to make sure our line is still good. Next, we'll clean the port again. Now we're ready to give the medication. We'll do our final check. We have Dilaudid at 2 milligrams per milliliter, and it's going to be that slow push. So now we'll give it. So you're going to be doing about 1.5 ml every 2 minutes with this. And for video purposes, this is sped up. And then the last thing we're going to do is we're going to clean the port one more time and finish off with one more saline flush. Do another 5 milliliters. All right. And now we're going to dispose of any leftover equipment. We're also going to document that we gave our medication to our patient as well as how they tolerated it. We'll come back and check on them in a little bit. And then the last thing we're going to do is we've now received orders to discontinue the infusion after our last round of clafurin. So we're gonna get our supplies. We'll have our gauze, maybe a Band-Aid, as well as some tape. So we'll perform hand hygiene. So now we're going to remove our dressing. And now we're going to take our gauze and we're going to apply pressure above the catheter in the vein, and we're going to withdraw it. And then you're also going to check to make sure that no particles or parts of the catheter end were left behind. And then we'll go ahead and dispose of it. And then we'll go ahead and continue pressure and tape it so that it stays in place. And then we'll document that we discontinued the IV and any other abnormalities that we found.